Imagine a world filled with constant noise, a high-pitched whine, a low, pulsating hum, or a roaring rush that never ceases. This is the reality for millions living with tinnitus, a phantom noise that plays relentlessly in their ears. Meet Sarah, a vibrant musician whose life took an unexpected turn. One morning, she awoke to a faint ringing in her ears. She dismissed it as temporary, hoping it would fade away, but it didn't. The ringing intensified, interfering with her sleep, work, and passion for music. Tinnitus is not a disease in itself, but rather a symptom of an underlying condition. It's a sign that something is amiss within the auditory system, the complex network responsible for hearing. This system, comprising the ears, the auditory nerve, and the brain, works in harmony to process sound waves and translate them into meaningful information. When this intricate system is disrupted, it can lead to the perception of phantom noises, the hallmark of tinnitus. The exact cause of tinnitus is not always clear, and it can vary from person to person. It can be triggered by factors like loud noise, ear infections, age-related hearing loss, and certain medications. While there is no single cure, various interventions can help manage symptoms and improve quality of life. The causes of tinnitus are as varied as the sounds themselves. One of the most common culprits is exposure to loud noise. Concerts, construction sites, and even prolonged use of headphones can damage the delicate hair cells in the inner ear, leading to tinnitus. Protecting your hearing by limiting exposure to loud noise and using hearing protection when necessary is crucial. Another common cause is age-related hearing loss, where hair cells in the inner ear naturally deteriorate. Ear infections can also trigger tinnitus by causing inflammation and fluid buildup in the middle ear. Prompt treatment of ear infections is essential to prevent complications, including tinnitus and permanent hearing loss. If you experience ear pain, discharge, or hearing loss, seek medical attention promptly. The constant presence of tinnitus can take a significant toll on one's emotional and psychological well-being. The relentless noise can lead to feelings of frustration, anxiety, and even depression. The inability to find silence can be incredibly isolating, making it difficult to connect with others or enjoy everyday activities. The psychological impact of tinnitus can be particularly challenging. The phantom noise can interfere with concentration, making it difficult to focus on work, studies, or even simple conversations. It can disrupt sleep, leading to fatigue and irritability. The chronic sleep deprivation can further exacerbate the emotional distress, creating a vicious cycle. Seeking professional help is crucial for managing the emotional and psychological impact of tinnitus. Therapy, counseling, and support groups can provide valuable coping mechanisms and strategies. Cognitive behavioral therapy, or CBT, can help individuals identify and change negative thought patterns and behaviors. Mindfulness techniques, such as meditation and deep breathing exercises, can help reduce stress and improve overall well-being. Section 5. Living in a muffled world. Hearing loss and its challenges. Hearing loss, often a companion to tinnitus, presents its own set of challenges. It can range from mild to profound, impacting communication, social interactions, and overall quality of life. Imagine struggling to hear conversations in crowded restaurants, missing important announcements, or constantly asking people to repeat themselves. The inability to clearly hear the world around them can lead to feelings of frustration, isolation, and even embarrassment. Hearing loss can affect people of all ages, from infants born with congenital hearing loss to older adults experiencing age-related hearing decline. The social implications of hearing loss can be particularly challenging. Individuals with hearing loss may struggle to participate in conversations, especially in noisy environments. They may withdraw from social gatherings, fearing that they won't be able to hear or understand what's being said. Fortunately, there are various assistive devices and technologies that can help individuals with hearing loss maintain their professional lives. Section 6. The ripple effect, social and professional consequences. The impact of tinnitus and hearing loss extends far beyond the individual. These conditions can have a ripple effect, impacting families, relationships, and professional lives. Family members may struggle to understand the invisible torment of tinnitus or the frustration of hearing loss. Social interactions can become challenging. Individuals with tinnitus may avoid noisy environments, such as restaurants and parties, due to the increased sensitivity to sound. Those with hearing loss may struggle to follow conversations in group settings, leading to feelings of isolation and exclusion. In the professional sphere, tinnitus and hearing loss can have significant consequences. Employers can play a crucial role in supporting employees with tinnitus and hearing loss by providing accommodations, such as quiet workspaces and assistive listening devices. Fortunately, there are resources available to help individuals manage the financial burden of these conditions. Section 7. Seeking silence. Medical interventions for tinnitus. While there is no cure for tinnitus, various medical interventions can help manage the symptoms and improve the quality of life for those affected. Sound therapy is a common approach to tinnitus management. It involves using external sounds to mask or reduce the perception of the tinnitus. Cognitive behavioral therapy, or CBT, is another effective intervention for tinnitus management. CBT helps individuals identify and change negative thought patterns and behaviors that contribute to their distress. In some cases, medications may be prescribed to manage underlying conditions that contribute to tinnitus. For example, if tinnitus is caused by an ear infection, antibiotics may be prescribed to clear the infection. If tinnitus is associated with anxiety or depression, antidepressants or anti-anxiety medications may be helpful. The decision to use medication should be made in consultation with a healthcare professional. Section 8. Embracing change lifestyle adjustments for tinnitus management. Lifestyle adjustments can play a significant role in managing tinnitus. One of the most important lifestyle changes is reducing exposure to loud noise. Protecting your hearing is crucial for preventing further damage to the delicate hair cells in the inner ear. Stress management is another essential aspect of tinnitus management. Finding healthy ways to manage stress, such as exercise, yoga, meditation, and deep breathing exercises, can help reduce tinnitus intensity. Regular exercise can also improve sleep quality, which is often disrupted by tinnitus. Certain dietary changes can also be beneficial for tinnitus management. Reducing caffeine and alcohol intake can help reduce tinnitus intensity for some individuals. Avoiding certain medications that can exacerbate tinnitus is another important consideration. If you suspect that a medication is contributing to your tinnitus, consult with your healthcare provider to discuss alternative options. Section 9. Reclaiming sound hearing aids and assistive devices. Hearing aids and assistive listening devices can significantly improve the quality of life for individuals with hearing loss. Hearing aids amplify sounds, making it easier to hear conversations, environmental sounds, and other auditory stimuli. Assistive listening devices, or ALDs, are designed to enhance hearing in specific situations, such as watching television, attending lectures, or talking on the phone. Cochlear implants are a more advanced option for individuals with severe to profound hearing loss. These devices bypass the damaged portions of the inner ear and directly stimulate the auditory nerve. Cochlear implants can restore some degree of hearing for individuals who do not benefit from traditional hearing aids. Bone-anchored hearing systems, or BASE, are another option for individuals with conductive hearing loss or single-sided deafness. They offer a non-surgical option for improving hearing and communication. Section 10. Finding harmony. Support groups and community resources. Connecting with others who understand the challenges of tinnitus and hearing loss can provide invaluable support and encouragement. Support groups offer a safe and welcoming environment for individuals to share their experiences, learn coping strategies, and connect with others who are facing similar struggles. Community resources can also provide valuable assistance for individuals with tinnitus and hearing loss. Local hearing healthcare professionals can offer diagnostic evaluations, treatment recommendations, and ongoing support. Audiologists can fit and adjust hearing aids and assistive listening devices, and they can provide guidance on communication strategies. Educational programs and workshops can provide valuable information about tinnitus and hearing loss. Online resources can also provide a wealth of information and support for individuals with tinnitus and hearing loss. The American Tinnitus Association and the Hearing Loss Association of America are excellent resources for information and support. Section 11. A brighter horizon. Hope and resilience in the face of auditory challenges. Living with tinnitus and hearing loss can be incredibly challenging, but it's important to remember that there is hope. By embracing a proactive approach, seeking support, and exploring available resources, individuals can navigate these challenges and live fulfilling lives. It's essential to remember that you are not alone in this journey. Millions of people worldwide experience tinnitus and hearing loss, and there is a wealth of support and resources available to help you cope. Technological advancements continue to offer new possibilities for managing tinnitus and hearing loss. Innovative hearing aids, assistive listening devices, and sound therapies are constantly evolving. Living with tinnitus and hearing loss can teach valuable lessons about resilience, adaptation, and self-care. Embrace the journey, and remember that you have the strength and resilience to navigate these challenges and live a fulfilling life.